Joining us now for our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Pleasure to join you.
So what is the current state of Canada's healthcare system following the emergence of the Omicron variant just 10 weeks ago?
Well, what we're seeing is a health system that is strained by a pandemic wave that's hit at the worst possible time. It's caused significant illness in our own healthcare workers, which means less staff in hospitals, and clinics are filling up with COVID-19 patients more than ever, and they need hospitalization and care. To keep up, the hospitals have asked staff to forego holidays or take overtime shifts, which of course means asking healthcare workers already exhausted by 2 unrelenting years to take on more work. The problem is global, however. A report from the International Council of Nurses this week said that sickness, burnout, and staff departures are taking a toll on the world's nursing workforce, which has been unseen so far in the pandemic.
And how does all of this compare to the beginning of the pandemic when it first emerged in 2020?
At the beginning, we saw our healthcare workers energized, ready to take on the challenges of this new disease. Initially, there was very little we knew about COVID-19, but over time, we've learned about its virulence, effective sanitation methods, vaccinations, and we were quite successful in deploying those vaccines to help battle the infection. But during that time, our healthcare workers were strong and resilient. But even this incredible resilience may be fading for many. And I think there's only so much we can ask our frontline workers to do.
Indeed. And on that note, we've seen a surge in 2020 on the onset of the pandemic. The Delta variant caused a surge, and now we're seeing surges in Omicron. How have these multiple surges in cases affected the morale and mental health of health workers from your personal experience, Dr. Raut?
It's a good question. I think the COVID-19 science table, which is the advisory table for Ontario, sums it up quite well. In the spring of 2020, the prevalence of severe burnout was about 30%. Not a great number, but there we are. But what we know now is the prevalence of severe burnout is greater than 60% in Canadian physicians, nurses, and other healthcare professionals. The ones that are at particular risk are intensive care setting workers, COVID-19 units in hospital, emergency departments, as well as nurses and younger healthcare professionals or trainees have been at a much greater risk of burnout.
Some very concerning numbers there, Dr. Raut. So what needs to be done to ensure our healthcare workers are not further overburdened as more restrictions ease across the country?
So as Canadians, we do take pride in our public healthcare system, but by failing to really adequately invest in it, governments can leave that vulnerable, especially to the ravages of a 2-year-long public health emergency. If healthcare workers leave and are not replaced, thanks to training or certification backlogs, capped wages, or even the perception of a punishing profession, that all hurts health system capacity.
All right, Dr. Raut, just about a minute and a half left here, but switching gears, last week we really talked a lot about this new BA2 Omicron descendant. It was relatively new last week, but what are the most latest developments around this BA2 Omicron descendant?
That's right. So what we know now is BA2 is likely much more transmissible than the common BA1 or the original Omicron, and it's been able to infect vaccinated people, according to a very recent Danish study. The study looked at coronavirus infections in more than about 8,000 Danish households between December and January, and they found that the people infected with BA2 were roughly 33% more likely to infect others compared to BA1. So we expect these results are relevant to us as well. But the good news is preliminary analysis shows hospitalization risks are the same between BA2 and BA1.
All right, Dr. Raut, just about 30 seconds left here, but what does normalcy look like for you as we try to potentially live with COVID-19?
I think once we go past the Omicron peak, we're going to see COVID-19 more as an endemic disease here. At that point, I expect there will still be some need for masks and, of course, hand washing. But it's going to look like the flu, where we get an annual vaccine booster to keep our immune system strong against COVID-19.
All right, Dr. Raut, always great having you on Forum Daily. Thank you again.
Thanks so much.